Hello and welcome to this webinar extract brought to you by the Professional Education Training Working Group of the World Federation of Public Health Associations as part of the 2024 Global Public Health Week program. The full webinar, titled Translating the Essential Public Health Functions into Public Health Curricula, is particularly relevant to the Global Public Health Week sub-theme, Fostering the Development of the Right Competencies Within Tomorrow's Health Workforce. The World Federation has a collaboration plan with the World Health Organization, and several members of our working group have been active contributors to the WHO's Roadmap project to professionalise the public health and emergency workforce globally. This webinar outlines work undertaken by the WHO Technical Advisory Group to develop the competency and outcomes framework for delivery of the essential public health functions for implementation in education and training. We explore how the WHO has taken the newly revised functions, outline how these were adapted into a competency and outcomes framework, and finally present the vision for and mechanisms to support incorporating functions into curricula. Our panellists include Ataya Massam, Siobhan Fitzpatrick, and Laura Magana. However, in this excerpt, we highlight the process by which the functions were incorporated within the competency and outcomes framework, which is presented by Siobhan Fitzpatrick, the Technical Officer in the Health Workforce Department at the WHO in Geneva. Thank you for joining us.
Thank you, and thank you so much, Ataya, for setting the scene very much on the work, the foundations of the WHO and partner roadmap to strengthen the workforce for the EPHFs. So going back a slide. So the competency-based education aspect, how do we strengthen the education of the workforce to enable them to deliver on those EPHFs? So the work that I'm able to share with you today, it's in a pre-final form, so we are able to share advanced insight into the competency and outcomes framework that has been developed and prepared by partners over the last 12 to 18 months. So we have developed a competency and outcomes framework to guide the strengthening of curricula, so to define the outcomes of curricula, but also the process through which competency-based education is designed and delivered effectively. Competency-based education is, of course, an extremely effective way of strengthening, of preparing the workforce, because it is rooted in the outcomes that are relevant for employment. So we're very much thinking about the contributions of individuals to those essential public health functions, which, as we've seen from that previous presentation, are very high level there for the system, for a whole country, for a whole workforce to provide and deliver on. So when we start to work backwards from those 12 essential public health functions, we've heard from how these can be then deconstructed into what are the sub-functions, the services, the enabling services. And really what we are focusing on in the competency-based education approach is what are the tasks of individual workers towards those EPHFs. So of course, in the same way that those EPHFs are interrelated, we can find that sort of a lot of the tasks are interrelated. So we don't have somebody who their whole job is health protection, because of course that interacts with disease prevention, with emergencies preparedness. So we're very much looking at those EPHFs in the round and then trying to identify what it is that individuals do towards those EPHFs. So the public health and emergency workforce is enormous. It's all of us. So a lot of us, when we refer to the core public health personnel, so those health workers with specialized training or whose role is entirely around public health, but we also recognize that actually all clinical practitioners make a big contribution to public health through surveillance, through health promotion, or perhaps with specific responsibilities in public health as part of their clinical role. So that's the group on the left-hand side. The third group of the workforce that we talk about is also personnel from other allied occupations whose roles are particularly focused on the determinants of health. So this is everything from street cleaners or data analysts, or policymakers. So people who might not necessarily be identified as those core public health personnel, but we want to look at actually how do we ensure that the entire workforce is best prepared to deliver their tasks towards the EPHFs. So a couple of slides just to make sure that we are all talking the same language when we say competency-based education. What do we mean by that? And then I will be able to walk us through both the framework, but also how we developed that framework. So competency-based education, it's a whole of program approach. A competency framework helps to define the outcomes of a curriculum. And then when we are developing that curriculum, it's also about the progression of learning content. It's the learning experiences to enable learners to develop those outcomes. It's assessment of achievement of those outcomes. So where we start from health needs, health systems, and in this case, the essential public health functions and the services, sub-functions, enabling services, and then we tease out, so what is the contribution of individuals? So what are the outcomes of the education program that individual needs to do to perform their tasks for practice? And what are the competencies that they need to do so? And then from those outcomes, we can look at the content of the curriculum. The competency model that we have adopted with this framework is a holistic approach to competence. So we focus both on the practice activities, the groups of tasks that an individual will do in practice. So these are things that you might see in a job description or something that you could delegate to somebody else. But we know that the provision of public health services is so much more than a task list. We need people who are able to make effective decisions under pressure, collaborate in teams, draw from the evidence, communicate effectively. So these are the competencies of the individual, their behavioral, that enable effective performance of the practice activity. So when we're thinking about how best to prepare individuals for work, we need to think both about what it is they do and how they do it. What are the attributes of the individual? This, of course, is rooted in the very essential foundations of knowledge, skills, and attitudes. So very much when we're looking at the whole curriculum, we need to think about all of these different aspects together. And then last slide on the theory of competency-based education. When we think of competence, we're thinking about the outcomes of the program aligned with employment, but we know that learning is, of course, on a continuum and that different courses, different learners will be at different stages. So when we're defining curricular outcomes, we really need to think about what is the outcome of this program? Where will that learner be in their sort of learning journey? What is the teams they'll be working in? What are the level of supervision or the responsibilities? So developing a policy might be on a sort of institutional scale through to international scale. So there are different ways to think about that learning progression. Sorry, forgive me. So when we set about developing this competency and outcomes framework, we are not the first to do this. So we had a big task ahead of us, looking at the breadth of the workforce and the breadth of the public health functions. So we started from looking at what is already out there, and we identified more than 100 frameworks, existing frameworks on these different areas. So we had a scoping review, as well as web searches and through the expert network, to identify 125 existing competency frameworks. We also looked at guidelines, guidance, what are the policy documents and strategies around the different aspects of public health and emergencies. And then through looking at that existing content through the lens of that competency model, we started to organize the content into the different tasks, the different competencies, to identify the overlaps between the different occupational groups. So this was a very thorough process. There are huge spreadsheets with thousands of rows with the different tags looking at the content. So this was very much an iterative development. There was a research team. So it was the World Health Organization in partnership with NHS England, Health Education England at the time, Imperial College London. And we also worked with the support and supervision, the guidance of a global technical advisory group. And of course, all of the speakers on this webinar today were members and co-chairs of that technical advisory group. This work was part of the roadmap steering of the overall roadmap, which had its own steering committee. So again, this work was feeding into that overall roadmap and ensuring that we are very much aligned with, for example, the work to define the essential public health functions. we recognize that actually, sort of in line with good practice, even with that breadth of that global expert advisory group, we still needed to bring in perspectives from people in different countries, in different occupational groups and areas of work. And so we very much sought to involve a wide expert network in the consultation and validation. So, so this is just to acknowledge the members of that technical advisory group, and you will recognize some of the faces there. So 23 different members who provided that oversight throughout. And then when we look at, in addition to those 23 advisors and the research team, we also involved more than 140 different experts. So we actively sought that global distribution. Of course, we didn't quite achieve sort of equal regional distribution, but we did bring in perspectives from across the 6 WHO regions, as well as at different stages of their careers and in different professional backgrounds. And one that we can't say that we set out to achieve, but somehow we achieved a 50-50 gender balance, which across the different experts that we involved in this work. So there was an iterative process. Obviously, we started small, looking at the scope. What are the practice activities towards the EPHFs? And then with each iterative draft, we were able to validate, update feedback based on feedback through the different consultations, and expand iteratively. So the technical advisory group was very closely involved in conceptualizing and organizing the content, overseeing the research team. And then once there was a full first draft, that was when we opened the consultation to that wider expert group. So there were 3 drafts that were subject to global consultation. And as you can see along the bottom, in terms of the volume of impact, so we invited free text feedback to really capture the richness of feedback and insights, which we were able to integrate in successive drafts. So now I can share with you the content of the framework itself. So it is organized into 4 chapters. The first chapter covers the background, the methodology, the context of the EPHFs, and of course, principles of competency-based education. But what we're really interested in here are the competencies and the practice activities towards the EPHFs, and of course, the guidance, which is in chapter 4, on how to integrate those competencies and practice activities into curricula. So how to use the framework to guide and strengthen existing education programs or create new education programs. So actually flipping that content round, starting with the practice activities, because of course, when we start curricular design, we need to know what it is that somebody will be able to do on course completion. So this is we identified 40 practice activities organized into 5 domains, and this is for the breadth of the workforce. So for the entirety of those 12 EPHFs, and for the breadth of the core public health, clinical practitioners, and other occupational groups for whom public health is a part of their role, we identified 40 areas of work. And these were broadly organized into health systems, public health intelligence, from gathering information, acting on that information, public health programs and services, the management of resources, and also emergency management, from preparedness, risk management, risk response. So you have on the screen some examples of the practice activities. Of course, no individual can be responsible for a practice activity in entirety. So when developing curricula, it's important to then look at what within those practice activities is within the responsibility of an individual. So within the framework, we have then further elaborated example tasks. We've linked these back to the EPHFs and their sub-functions. There are illustrative profiles, an illustrative profile from each of those 3 occupational groups, but also at different career stages. So from an early career person through to a senior person with leadership and decision-making responsibilities, to guide how to adapt from the framework. Of course, by definition, the framework is not standards, it's not authoritative, it's almost a menu of those different outcomes. There are also curricular guides exploring the different areas of knowledge and topics that would need to be covered within a curriculum, that an individual would need to develop in order to be able to perform the tasks as part of their role responsibility. So there are 40 of these in the framework. One of the really interesting findings that we had when mapping the competencies, the behavioral attributes of individuals, is the commonality. So we identified that to deliver across those practice activities, that individuals need to have competencies that are community-centered, competencies for decision-making, effective communication, collaboration, be it with teams, with communities, with organizations, including organizations and actors outside of the health sector, interpreting and acting on evidence, and also their individual personal conduct. So in the framework, we identify 20 competencies, and we further elaborate, so how do we know if somebody has those competencies? What does it look like? And we elaborate on these in their behaviors that demonstrate those competencies. So the reason we started with the practice activities and then go to the competencies is these competencies enable the performance of practice activities, but they're also observed and assessed in the context of those practice activities. So we could not certify somebody as, you are an effective communicator. We need to know, what are your role responsibilities? Is that developing a public health campaign? Is that organizing a team meeting? Or is that collaborating with communities? And then once we have that practice activity for context, then we can start to see, what do those behaviors look like in practice? And then the final chapter of the framework is guidance for how to adapt from the framework, contextualize that, and bring that into curricular content. So again, going back to, this is a framework of outcomes, but we do elaborate actually some of the content and topic areas we would expect to see in curricula. So it's the competency-based outcomes that then guide the progression of content, the learning experiences, assessment, and of course, the design and delivery of education to enable learners to develop those competencies for their practice activities.